Hi, everyone. Welcome to our session. My name is Adela Ruiz. My pronouns are she, her, hers. I am calling today from Lenape lands here in New York City. And my background is a set of Black chairs. I have brown hair and olive skin, and I'm wearing a gold necklace. I have the privilege today and honor to be sharing this space with two of my colleagues, Risa and Ryan, to have a very timely and important conversation around race and health equity. And so I would love to pass it over to them now for them to introduce themselves as well, and we'll get started.
Hi, everyone. My name is Ryan Easterly. My pronouns are he and him. I'm a Black man with Black glasses and Black hair, wearing a yellow shirt, sitting in front of a white wall with diplomas on it. I'm pleased to serve as Executive Director of the With Foundation, and I come to you today from the land of the Ohlone people, now known as Redwood City, California.
Hi everyone, I'm Risa Jag Rifkin, and my pronouns are she, her, hers. I am the Director of Civic Engagement and Marketing for Disability Lead. Disability Lead is a network of people with disabilities who are using our identities and our power to create a more just and equitable society. We're based in the Chicago region. I'm actually joining you from Las Vegas, or the land of the Nuuvi, Nuulu, and the Nuwu people. I'm a brown woman with purple glasses today, red lipstick, long brown hair, silver jewelry, and a pretty nondescript office that has a sunflower framed on the wall. So with that, I'll pass it over to Adela.
Thank you so much, everyone, for those introductions. And just a quick addition, I'm also calling today from the NBA, the National Basketball Association. I'm with the NBA Foundation as the Program and Grants Manager. So I would love to dive into this. When we initially began to conceptualize the conference, it could not be a more timely theme to have a conversation on race, disability, and health equity, given the 2 years we've had. I want to put us into current context, but I'd be remiss if I didn't address what 2020 has meant for the disability community. We are coming out of one of the hardest years by far, at least in my lifetime. But as members of the disability community, I think it's quite blatant, the amount of inequity that the community experienced, from healthcare rationing to being denied or being excluded from much needed relief. And really, the pandemic is not over. And sadly, while there have been some steps forward, people with disabilities, specifically people with disabilities of color, Black, brown, indigenous, queer, trans, are disproportionately affected by these inequities. And so the pandemic is far from over, and disability community still struggles. And so I say this because as we're having this conversation, we have members of the community continue to die of the pandemic, be denied essential resources, still battling with a system that has and continues to fail them. And so I think it's important to address that. We really wanted to frame us in this moment, the one we're in. And so all of that being said, I wanted to get your reactions and maybe a reflection on 2020 as we're all still reeling with the pandemic. So I'll start with you, Risa.
Sure. Yeah, it has been, continues to be a very hard 18, 19, 20 months. I can't count anymore because it seems like 1 month runs to the next, and I think that our community, as you said, Adela, is still very much struggling between the pressures of some things returning to in-person, some things staying virtual, and then a continued lack of access to, you know, everything from vaccines to healthcare to day-to-day services. And so I think this is I think we've learned a lot, unfortunately, from a lot of tragedies, that we can work remotely, that we can have accommodations be met so that we can fully participate, be employed, live where we want. And yet, because we have not dealt with a lot of the systemic oppression, we haven't realized all of what that could mean. And then again, between the tension of, a lot of expectations, a lot of employers are expecting us to return to the office, but it is still not safe for many of us. A lot of people I know have still not gone out at all, even with being vaccinated. It's still not safe, and they're not comfortable doing that. And so, putting us in a position again of choosing what feels like life and death decision. Do we work? Do we not work if we're not having these accommodations met? But I don't know if that fully answers your question, but that's what I'm thinking, and that tension, is still strong.
Yeah, definitely does. And so Ryan, this is your day to day. What are your thoughts?
I wholeheartedly agree with everything that's been said so far. I think in the work of With Foundation, as a healthcare funder that promotes comprehensive healthcare for adults with developmental disabilities, we see a lot of the same. It really, this pandemic has really brought a magnifying glass to many of the issues that we've struggled to address, that the disability community experiences in general, but especially people of color with disabilities. I think everyone here today knows, people of color experience environmental discrimination. So much about our existence. Your zip code can be a primary predictor of your health versus many other genetic things about your health. That is also true for people of color with disabilities. When we look at things related to the vaccine and now the booster, we're still struggling with, booster availability. If you're an individual who has experienced trauma from the healthcare system, we're now adding on one additional shot for the booster. How do we appropriately educate all communities, but especially communities of color with disabilities, to help them address the concerns around the booster? But really in general, this pandemic has really brought a magnifying glass to the issues we've always been aware of. And from Wit's perspective, I would also add that we've been a longtime funder of telehealth, but there's still issues and still barriers that some experience in accessing medical services via telehealth. So we're proud to fund in the area, but there should be a lot more services available via telehealth, and a lot more education needs to occur in communities of color, and there are still access concerns in communities of color. So I would add that to the conversation.
I mean, it's an incredible addition. And so what I pull from these reflections and even my own experience, you see like the pandemic of COVID and what's often referred to as the pandemic of racism happening in tandem. And so I couldn't think of a more timely and important definition to introduce into discussion than Talila Lewis's definition on ableism, because I think it really does encompass these two concepts very well. And so Talila Lewis defines ableism as a system that places value on people's bodies and minds based on societally constructed ideas of normality, intelligence, excellence, desirability, and productivity. These constructed ideas are deeply rooted in anti-Blackness, eugenics, misogyny, colonialism, imperialism, and capitalism. This form of systemic oppression leads to people and society determining who is valuable and worthy based on a person's language, appearance, religion, and or their ability to satisfactorily reproduce, excel, and quote, behave. You do not have to be disabled to experience ableism. And so I want to thank TL Lewis for really conceptualizing and articulating such an important definition and framing of the term. And I want to hear from you all, when you hear this definition of ableism, what are maybe reactions or thoughts, or how do you fold this into your broader understanding of the interplay between race and disability? And I'll throw it back to Ryan. I'll alternate the order.
I think from my perspective, especially in considering the effects of the pandemic, I think a lot about, especially in terms of the broader disability community, the impact that this pandemic is going to have on people's mental health, and in some ways how it's going to broaden who's a part of the disability community. And especially in terms of ableism, it's important to remember that it's not just people that have an apparent disability, that you can also experience ableism if you're perceived to have a disability. So that's part of what I think about. I also think about, in general, in terms of my own journey in my own life. I'm an individual with disabilities, both apparent and non-apparent, but I also happen to be a gay man, and kind of how within the healthcare system, we struggle with people who are multi-marginalized. Even in my own care, as someone who has the privilege of running a healthcare foundation, so often I have to segment the way in which I receive services to certain topic areas. It's sometimes a struggle to have someone see me as the complete person for all my identities, all the ways I navigate spaces as a whole. So I think in terms of kind of the challenges that remain for the disability community, but especially people of color in receiving services in the healthcare system, it's still having doctors and medical professionals begin to see the multiple identities that we all carry. Instead of, I shouldn't have to go see, here's a doctor that I'm seeing about disability stuff. Here's a doctor that I'm seeing, as a general check-in. Here's a doctor that I see about things pertaining to my sexuality. It should be that I receive services for the whole person. So that's my perspective, but I know Marisa has a lot of important things to add. So I'll turn it over to her.
Thanks, Ryan. When I look at Talila Lewis's definition, I think what it does is it adds a very crucial and needed lens of race, and specifically anti-Blackness, to the medical model of disability, which really looks at disability, in this horrible, horrific way, where medical professionals look at disability, look at us and say something's broken, we need to fix it. And that couldn't be more opposite from how I feel and how a lot of others feel about our disability. And when we layer that on top of, racist practices, anti-Blackness practices, and then with the addition of, you don't have to have a disability to also experience ableism, I think is a really powerful intersectional approach to how, ableism connects back in so many ways to, white supremacy. And so, to me, like Ryan shared, I mean, all of us could probably share the horrific moment where we've not felt like we could either access or were in rooms where we were fully understood as human, right? And so what that looks like is inequitable healthcare. And I know I'm jumping to the next question a little bit, but that's where I'm going to leave that question, because I think Adela's question is where I plug in some interesting information that Ryan alluded to.
Yeah, I mean, what resonant responses, I've been just nodding because it is such a shared experience, and speaking for myself too, right? Like how many times going and even trying to identify the right care as a woman of color, you are not believed, or you're told that you may not be disabled enough or you don't seem to say like, and those things are particularly painful, right? When you have invisible disabilities and, you know, you have things like, oh, well, you don't look disabled, the delegitimizing of what people's experiences are when so many people with disabilities just press on and feel that they need to hide these things to truly be supported and accepted, or just to exist in a society that is not welcoming. I also just find this definition to be so powerful, because to me it sounds like an invitation to dismantle ableism. So that last line around, you do not have to be disabled to experience ableism. I also think, and I don't want to speak for TL at all, but it's like, you do not have to be disabled to dismantle ableism either, right? Like, it should not be the onus of the community that's affected by these inequalities alone to address them and to call out when these behaviors are harmful. And we see this with transitions back to work and excessive needs for documentation and for showing and proving that frankly not all groups have access to. Ryan and I and we might be able to see a specialist or whatever it is, but if you don't have access to basic health care, where do you even begin to understand your own experience, or even, you know, request accommodations or do all of that if you don't even have that basic entry point into the healthcare system? And so I say that to lead us in, as Risa said, into my following question, which is really about health equity. And I would love to hear from you all, because I know there are many definitions floating around of health equity. How would you define, or how does your organization, if you prefer, define health equity? And what would it look like truly to actualize health equity for disabled people of color? And I'll throw it right back to you, Risa.
Sure. This is a personal definition, so please don't, quote Disability Lead on this. We are a network of people with disabilities, and so that framing is important. But, I look at health equity more concretely as what we imagine if the inequities that existed don't continue to exist, right? So health equity to me means that we can all access in affordable, accessible ways, quality care that is actual care that we want, that we determine that is self-directed, right? And so, I want to bring up now, how we have seen inequities and ableism play out. And because, this is a panel of 3 people of color with disabilities, want to call out, we have different experiences, but, we are all looking at these definitions, these constructs in really intersectional ways. And so, I think Adela will help fill in some definitions around disability justice, but I see health equity being achieved when we reach disability justice, which recognizes that those most marginalized, including BIPOC, people with disabilities, trans people, are given space and the power to lead, to create solutions, we will all thrive, right? And so, but right now we see inequities playing out in, the American Center for, in the Center for American Progress, in a study that highlights that trans people, 30% of trans people in their study reported that physicians refuse to see them. We're also in a country where the pain, and I think Adela started talking about when our pain, our symptoms are not taken seriously, when we hear a lot that Black women's experiences are not taken seriously, and our maternal mortality rate is so high, and Black women are 2.5 times higher likely to die from giving birth. We have a serious problem. And then when we layer in disability on top of that, I think that a crucial piece is we are not even represented in the healthcare industry, right? So physicians don't look like us, don't understand our experiences, even though we make up, 20 to 25% of the population. It's reported that maybe 2 to 3% of physicians identify as having a disability. So until we see shifts in understanding where and when all of those intersections come together, what our experiences are, and actually seeing people who look like us in the medical world, I don't know what will change until we get to that point. I also want to highlight, I'm talking a lot about, medical care in response to diagnoses. A diagnosis is not everything to us, right? But it's crucial to getting connections to resources and finding community and finding answers, right? And so I think that's an important framing. It's not like I'm saying we need access to physicians to find us some cure related to the medical model. That's absolutely not what I'm saying. But we should not, we should be taken seriously and understood. Is bottom line what I'm getting at. So, I'm hopeful, and we're seeing disability justice being talked about more with health equity, but we have a long way to go. So I'll stop there.
I think in terms of the work of with Foundation and my work, when we think about health equity, it really is about helping all Americans achieve access and accessible healthcare. And as a foundation, we believe firmly that all people should receive healthcare services with dignity and in a way that respects all their identities. As a funder, we specifically focus on adults with intellectual and developmental disabilities, but we also understand that people are multifaceted. People possess multiple identities. So we want to see the care they receive address all those identities, and that the care they receive is also culturally competent, but also is delivered in a way that has cultural humility. And when I say cultural humility, I'm meaning the framework that really acknowledges that the process of achieving cultural humility is a lifelong learning journey, but it should also include looking at the balances of power when you're engaging in partnerships, when you're delivering care, to really check yourself to see, are you making sure that everyone is on an equal playing field? Are you engaging in a partnership and engaging in providing care in a way that respects everyone in equal ways, as opposed to sometimes viewing people as, I'm an expert, and you're learning. It's everyone has expertise, everyone has value. In our funding and in the way in which we operate, we also try to see that people with disabilities are included in designing and developing the healthcare models that we fund, because we believe that people with disabilities are experts and that you have to have that expertise in order to really have healthcare services delivered in a way that acknowledges that and that is actually most effective for people with disabilities, but especially most effective for people of color with disabilities.
Yeah, I couldn't agree more, and just appreciate those reflections really around like the importance of identity and care. And as to say, I agree fully that we need representation, understanding, and to be seen fully, right? As humans, not just like the disabled person, the Black patient, the Latina patient, but really what does it mean to view healthcare as making people whole. And I also would add that the work of cultural humility belongs to everyone, is what I would think. Because many times I think a lot of times representation can be used to forego the agency maybe and the responsibility of those who might not share that identity, but everyone can learn and can improve and can expand their understanding. And I really appreciate those people who may not be of the community but are willing to work in that partnership that Ryan described as well, knowing that we must get more representation too. There's really no substitute, but this work can be shared is such a key piece. And so another concept that we began to bring into the conversation is disability justice. And I think disability justice is such a powerful framework in this context because it touches on identity as well, and really a lot of the themes that we're talking about. And so what I would love to do now is share the sins invalid framing of disability justice and talk a little bit about that as we continue to build here. And so how sins invalid has a wonderful primer that I would send everyone to go read that really explains the conceptualization of disability justice, but really a condensed version, which I hope captures the essence of it, is that disability justice is a vision and a practice of a yet to be, and a map or framework created with ancestors, grandchildren in the width and depth and multiplicities and histories of a movement toward a world in which every body and mind is known as beautiful. And so within disability justice, it is key to center the experiences of historically excluded groups. So queer, trans, Black, Indigenous, people of color, immigrants, and women. And as we are seeking to center, or practitioners of disability justice seek to center those experiences, also holding up 10 major principles, which are intersectionality, leadership of the most oppressed, anti-capitalist politic, commitment to cross-movement organizing, recognizing wholeness, sustainability, commitment to cross-disability solidarity, interdependence, collective access, and collective liberation. And so with this definition of disability justice and knowing the disability justice values, a few of which we began to incorporate, like intersectionality and seeing individuals as whole and for their wholeness, I wanted to hear from you all. What does that definition mean, and how can a disability justice framework help us expand our understanding of health equity? And I'll start with you, Ryan.
Well, I think in covering the definition, you hit on a point that I find most valuable in our work, which is really the leadership of the most impacted. I think as a funder, if you design programs and you're looking at funding programs that really center the needs of the most impacted, that's always the best starting point. It's by the fact you're putting the people that are oftentimes the hardest to reach, or we hear are the hardest to reach, hardest to designing programming for, you're putting them at the center, you're allowing them to shape the program, I think really is the way to support and fund the most effective work, particularly in the healthcare space. But I think really disability justice, by really bringing that out, is very helpful. I would also add in general that it really touches on and lends itself to discussions around social determinants of health that are so much broader. So it can touch on, food availability, food deserts, and so many other things about our experience that also are related to accessing healthcare, but are oftentimes harder to discuss, especially in traditional conversations about healthcare services and healthcare service models. So I think the discussion about disability justice also lends itself to conversations around social determinants of health.
Risa?
Yeah, sure. I mean, I think Ryan hit on one of the most meaningful tenets of disability justice to me, as a woman of color with a disability, really focusing on the leadership of those most marginalized speaks to me in ways that are incredibly personal and valuable and excites me most. I mean, at Disability Lead, our network of people with disabilities, are representative of that intersection of identity. And it's really our goal to have our leaders, who have those experiences, who have those identities, makes the change. Because like Ryan said, I said earlier, when we create and allow for leadership, right, of those of us most marginalized, our world could look totally different. With the data that I shared earlier, imagine someone who sits at the intersection of trans and Black and disabled, right? We know our systems aren't working, but if we listen and learn and value that person, we will be in a different place. So that's what really is the focus for me. And all other 9 principles are equally valuable. Not saying they're not. That's just the one that makes me most excited.
Yeah, I agree, and I think for me, this idea, I know the term intersectionality is used so much, right? But what would it mean to really, really talk about the different spaces folks with multiple identities occupy, right? Oftentimes you see different experiences and maybe it's like ranked or like, we fund only race or we fund only a certain group. And I think truly disabled people are people of color, just to say it. So a lot of times when we're talking about disability, I think, and I don't think, I know from teaching and from working in community, the perception of disability can be very limited or can be very narrow, right? Very, very, very limited to like a white woman in a wheelchair as the perception. When then, you say disability is actually like depression and like anxiety, or disability is lupus, or you name a number of different invisible disabilities as well as visible, countless times you have people saying, yeah, that's definitely me. This is my family. But it's hard to really shift those perceptions. And so I think, for me, it's almost odd or bizarre that when we're having conversations about disability, they're not conversations about race. And Ryan brought up this really important data that I wanted to raise, that the CDC reported 1 in 4 Black Americans identify as having a disability. 1 in 6 Latinos identify as having a disability. 1 in 10 Asian folks as having a disability. So the community we're talking about, it's not like an abstract concept, right? Like it's us, it's our family, it's our parents, it's our children, and anyone at any given point can join our poorest community. So I wanted to just say that, to say that the urgency of the conversation is because this is the experience of people of color. We are who represents this like critical mass of people with disabilities. And of course, white folks with disabilities are part of our community. And yet we continue to see the most extreme denial of key supports being denied to folks of color. So I think that's just important to name as we continue to understand and have the discussion. And I guess as a follow-up question to this piece on disability justice and health equity, I wanted to just revisit this idea of like timing, like how come this is urgent, right? Like what is at stake if we do not do the things that you both have identified as being critical to actualizing health equity? What do we all stand to lose as a community if we're not able to take these steps forward? And either one of you can start.
No, go ahead, Lisa.
My answer is super short. So, Ryan, jump in with more thoughts, please. But simply, I think it's just we risk staying where we are, which is not a great place. We are seeing, you know, Adela, as you shared earlier, the pandemic has hit disabled Black and Brown people very hard. There's been a disproportionate impact. There's been a lot of death, a lot of unneeded suffering in many ways. And I think, that's what we have to lose. I don't want to stay where we are. And in the before time, a lot of us here, like, when do we go back to normal? I don't know if we want to go back to normal either, because that too has so many systemic failures, and so just that's my answer. But Ryan, you probably have more to add.
I would reiterate that to me, there are lives at stake. As we touched on earlier, the pandemic is not over, and we know the disability community will be impacted by COVID-19 for far longer than our quote unquote able-bodied colleagues. So the pandemic is not over. I would also say that really it's what's at stake is we continue to have and support programs that aren't as effective as they could and should be. So by embracing more disability inclusion and disability justice in healthcare programming, it really is embracing a more effective approach. And regardless of what you're doing and what you're working on, to me, number one, I think if you are an individual or your organization happens to believe and say, oh, we don't do disability, then to me, you are being discriminatory. You are making it harder for people with multiple identities. You're making it harder for people of color with disabilities to exist, to survive and thrive. But also, if you add the lens of disability to your work, it will be more effective, regardless of what your individual mission is, your individual purposes, your individual programming. Adding disability will result in it being more effective and truly reaching more folks that we all want to reach. So I think that's what I would add to the conversation.
Yeah, and they're incredible additions. And this idea of just reaching people, seeing people as whole, meeting people where they are, really expanding your purview of funding to be more inclusive, I think are all incredible suggestions for steps forward. And so I want to shift a little bit, because I think we've raised such great, we've offered such great context and importance of this topic. And so from I guess, like, I always get asked this by my students, so I have to ask here too, concretely, right? Like, if I am here at this conference, I'm here at this session, what can I do as someone in a nonprofit, in philanthropy? What can I do today to help advance health equity for disabled people of color? And so I would love if we can reflect on suggestions, but even anecdotally, what are some things that you have seen groups do that have been great or have felt like steps forward? And Risa, if you want to answer either one. I just see Ryan's off mute.
Is Ryan off mute? Go, Ryan. Okay. So I was holding back because I answered first last time. But from this perspective of leadership, I think some really valuable, tangible things to do is ask and look at all of our organizations, whether a funder, a nonprofit, smaller organizations, bigger organizations. Do we have leadership of people with disabilities? Do we have leadership of people of color with disabilities? Importantly, do we have not just a token person either? Like, what does that expansive look like? And do we have that perspective in our staff from entry level to senior level? Do we have that perspective included in our board leadership as well, and not separate, right? Because I think everyone has brought up, right, disability is not a siloed identity. So, do we have disability? I lost my train of thought. That's what happens when you wake up 12 hours ago. Apologies. But do we have, are we looking at, as Ryan said, earlier, are we centering disability in our funding? If we're not, then we're making mistakes because we're everywhere, right? We are part of all communities. And so integrating disability into that is really crucial. I think of in Chicago, Rush University Health System had the late Martha Briscoe on their board, on their full leadership board. And when they built their new hospital, accessibility and universal design was thought of throughout the ideation and construction and building of the hospital. Certainly accessibility is just a piece of what we are talking about, but I think that is reflective of what we hope to be, the future where we are really looking at disability justice, beyond accessibility, disability justice in all of our strategies, and and funding initiatives that are thinking of disability is really crucial. It's normally a different separate funding, but it should be part of everyone's scope to make sure we are supporting organizations who are doing this work already. So Ryan, I'll pass it to you.
I would only say amen and underline everything you've just said, that it's important to find ways to include people with disabilities, especially people of color with disabilities, in your leadership, in decision-making positions in the work, finding ways for them to shape your work, even if it's in cases of using advisory committees. I would say specifically as a funder, if the attendees listening also happen to be funders, I would highly recommend looking at the Disability and Philanthropy Forum. The WITH Foundation is pleased to be a member of the President's Council for Disability Inclusion and Philanthropy, and that Disability and Philanthropy Forum has a great number of resources that will help you in your journey towards disability inclusion and disability justice. And it encompasses a wide array of resources and different types of funders that we're all in the journey. From WITH Foundation's perspective, we've been a disability inclusion funder since our inception in 2002, but there are things that we learn every day. We have an advisory committee that also advises us on our grant making. We do have members of our board of directors that identify as people with disabilities, as well as our leadership, but there are ways in which our advisory committee helps us learn and helps challenge us and enhances our understanding of the issues and understanding of how we should fund things every day. So I would encourage you to check out that resource. I would also add that there are organizations in your local area. Reach out to your Centers for Independent Living, your University Centers for Developmental Disability. There are disability organizations in your area that you can reach out to that will help you understand the issues in your local communities and beyond. I would also add that as you're incorporating this expertise and this lived experience into what you do, that WITH Foundation is a firm believer in that people with disabilities should be compensated for their time and expertise. So make sure that as you're getting this feedback and as you're experiencing the value of incorporating this lived experience in what you do, please make sure that you're compensating individuals. I will say, for myself as a multi-marginalized individual, I am sometimes very fortunate, especially growing up, to have people that ask me for my perspective, but it's not often that I was compensated. So please make sure you're doing that. And it's especially important for thinking about offering alternative forms of compensation, because we know people with disabilities, especially people of color that depend on government programs to survive and thrive, there are income limits. So allow for things like gift cards or alternative forms of compensation so that individuals don't have to put their livelihoods, the things they need to survive and thrive at risk in order to help you do what you do more effectively.
Yeah, I mean, these are all great. I'm just like clapping here because it's really true. And I think with this question, it's like the list is almost endless, right? If you're really serious about taking this work on, there's so much to do. There's all of the things you all said, and I have to because I'm a teacher as well, but it's education, right? And really being open to having difficult conversations about what race and disability mean in your organization and how ableism plays out. Like, it's not pretty to do the work of dismantling anti-Black racism or ableism, as a matter of fact, but it's so critical. And I often think of, you know, the brilliance and the talent there is in disability community of leaders that would love an opportunity to advise and work with disability community. And yet, sadly, the same resources are always used, the same one or two individuals who are not always a representative of the community. And it's okay, right? Like there's expertise that allies can offer, but it's not a substitute for lived experience that people of color with disabilities have. They exist. Folks are out there, they're ready to help. And it's just an invitation to say, you know, if you do not have disabled people of color at the table in conversations about disability, you are really missing out, and there's no substitute for that lived experience, and really returning to those disability justice values, leadership of the most affected. And so I really do want to challenge colleagues I know maybe on the line to really bring in those voices of the most affected, because you only have one piece of the puzzle if you don't have disabled people of color there with you, thinking through your strategies, talking through. And I would also just say, like, there are so many resources out there beyond the ones we've shared. So many amazing groups constantly sharing work and wanting to partner. So it's an invitation, and I'm sure we're happy to share with the conference any other resources or reading materials, but really do your best to educate yourself, and as you're seeking partners and opportunities, really invite disabled people of color specifically to those tables, especially the decision-making ones. And so we do have a little bit of time left. And so what I wanted to do, I have a couple more questions for our panel, is really to just, if people were open to just sharing like a reflection on what could it mean? What could it mean for you personally or for disability community, whichever of the two you prefer, to make the type of progress we've been ideating? Like what could it mean if this happened, and what would that mean maybe for your organization or for the community if we were able to get that representation, to get those funding dollars, to get those seats at those key tables, those decision-making tables? What would that mean for you and for your organization in the community? And I'll throw it back to you, Risa.
Put it on mute. I'm back. Okay. I think if we get to that point, disability lead would not need to exist, which is great. So that would mean we've achieved our mission, and we are not only healthcare focused. So we would have to be everywhere, right? But it would mean that we are leading with power and influence and making those decisions. It would mean on a personal level that I would be able to, find a therapist that was culturally appropriate for me, and not re-traumatizing me because they want to focus on my disability but not understanding that I'm also a woman of color, or those kind of experiences. It would mean that I wouldn't have been offered surgeries that are not needed to my care. It would mean that I would feel comfortable in doctors' offices and not only be seen by older white men. So that would be, what it would mean for me. And it would mean maybe that I would trust the field a little bit more than I trust right now. Ryan?
I think very, very similarly to you, for me personally, it would mean that rather than kind of segmenting how I receive care, that I would begin to see professionals in ways that can see me as the whole person that I am, for all my identities, all my experiences. As a funder, I would say that we would hear from our grantees and the individuals that they serve that they're experiencing care in that way, that we would begin to see medical service delivery programs really centering those that are most impacted in how they're designing those programs. That we would really see the leadership of those most impacted, including people of color with disabilities, highly valued and fairly compensated. And I would say I'm also mindful that, in this world, that in actuality, everyone would benefit. Yes, the disability community and people of color would experience the greatest benefits, but in fact, it would create more equitable healthcare for all, because it's similar to the curb cut effect. It's people with mobility disabilities need curb cuts, but everyone benefits. So in a way, it's through this approach that it would really create more health equity for everyone.
Yeah, and I mean, even hearing you both talk, it makes me feel excited about the future, if that was the one we're building toward. And I would say for me personally, it's very much the same, right? It's having not to look up hundreds and hundreds of different healthcare providers before you find one that could speak like your language. Or it would mean that my close friends and family members that do not have the same healthcare opportunities as I do would be able to get the care they need and maybe not have to travel abroad to get okay healthcare because it's just not possible for them. Or would mean that folks who were undocumented or people that couldn't afford to see a specialist would get the care they need to live whole, complete lives where they felt they were seen and heard, and felt that society just cared about them at a basic level. And so that future feels exciting. And I hope we get there. And I hope, these conversations are really catalysts to those who are able to move us forward. And us too, right? Like folks who are funders, scholars, academics, it's a team effort, and we need everyone in every discipline to be working on this together toward that vision. And so as we wrap up, I'm so sad to wrap up because this conversation has been just so rich and valuable and important and timely. I want to just share some final thoughts, right? Like, where do we go from here? We started the conversation around reflecting on 2020. We are here in 2021. What are our next steps as a community? And what, in addition to the wonderful recommendations we received, do you have a call to action or a final thought that you would love everyone who's still tuned into the conference to leave with?
I'll start. I'll say from my perspective, it's really about examining the ways in which you operate and the ways in which you're impacting your community. Find ways to have people with disabilities, especially people of color with disabilities, involved in shaping your efforts, involved in creating your funding opportunities. Whatever you're doing, just have people with disabilities, especially people of color with disabilities, at the table. Have them advise you in what you do. If you are a funder, I again would highly recommend you take a look at the Disability and Philanthropy Forum, and especially look at signing the Disability Inclusion Pledge, which is a pledge where we're seeking to advance disability inclusion and all kind of hold ourselves mutually accountable for working within our organizations to achieve more disability inclusion in a variety of ways. So please take a look at the Disability and Philanthropy Forum and consider signing the Disability Inclusion Pledge if you're a funder.
What Ryan said? I hope I'm pointing in the right direction on your
Yeah,
screen.
no, to me, it's yeah, you're good.
Okay. I mean, and this is a conference of funders and nonprofits, and do what Ryan said for funders. Connect with Ryan. I'm putting you on the spot, Ryan. Nonprofits, connect with me, connect with other organizations. Ryan is right in his answer before that there are organizations wherever you are that are crucial to achieving what we're talking about, whether they're centers for independent living, whether they're disability justice organizations, whether they're funders who are funding disability work now. Connect with them. Let's learn from each other and achieve, this society that I agree with. I'm excited about. So let's do it together.
Thank you both so much. And so with the time we have left, I would love to open up for questions from our attendees. So if you have any questions, attendees, feel free to send them our way now. Okay. I don't see a ton of additional questions, but what I do see, and I'm happy to share, the website is disabilityphilanthropy.org. So that is the Disability and Philanthropy Forum. Please register. There's a plethora of resources. I'm somewhat biased because there's a workshop on Ableism 101 that I host out there. So check it out. Just a really, incredible reservoir of resources to advance that learning. And I will hold off for questions. And as we're seeing if any filter through, I really just wanted to thank you, Ryan and Risa. It's always great to have a conversation, and to have it in this moment in such a public way was incredible. And I really do hope that the three of us, along with like our broader community and funders and academia, private sector colleagues, continue to engage in these conversations, because I truly think this is how we begin the incredible work ahead to get to that future. And so I also wanted to give a big thanks to the Upswell team for organizing such a rich conference and for hosting us, and excited to have you host us again in the future. And just immense thanks to Gail Fuller, Emily Harris, Emily Ladow with the Disability and Philanthropy Forum, all of our colleagues in the President's Council for Disability Inclusion and Philanthropy, funder partners, and the nonprofits that do this work every single day to ensure that disabled people of color are one step closer toward health equity. So I thank you all so much for spending your afternoon with us, and we hope to see you soon. Thank you.